Assalamu alaikum, community members, friends, and family. My name is Dr. Ali DABAJA. I'm a local physician, both in emergency medicine and also in critical care. And I thank the Islamic Center of America for graciously asking me to come here and talk a little bit about coronavirus, the thing that's really been on all of our minds. So this is going to be hopefully like a 5 to 7 minute update, kind of high yield, talking about the things that you may have questions about. So we're going to talk a little bit again, community update on corona, talk about safety and prevention, how we break the cycle of infection, treatment, and also preparedness. So a lot of people have, a question, the basic question being, what is this virus? And all of us have been getting a lot of information about this. Before we start answering questions, I think it's extremely important to understand something. Arm yourself with appropriate knowledge. And that knowledge should be coming from the people that are experts or have a lot of experience in the field. And that way we don't, contribute to some of the ongoing misinformation and potentially hysteria. And it's also important during this time that we remain completely calm so we can prepare and fight this all together and make sure that none of us actually are going to get sick and ill from this or any tragedies. So I would like to first talk about what is corona. So a lot of people think that it is a very deadly virus. Really, coronavirus is a type of virus that occurs naturally in the environment, and it's a novel virus, so that means it came from somewhere, potentially animal to human transmission. It's a virus that's similar to influenza or the cold virus or many other common viruses that cause very similar symptoms. And so what are those symptoms? The majority of people that get sick with corona will have some type of fever. So that is the first sign of corona. The second thing that will happen is we might start having respiratory symptoms. Those symptoms typically are a cough, and the cough is usually a dry type of cough. After that cough, you might start developing very similar signs and symptoms such as the flu, such as not feeling well and fatigued. That's the third most common sign. The fourth being you lose your appetite, you don't feel too hot, and you just don't want to eat. And the last thing that happens in people that have corona is typically they develop a lot of body aches and muscle aches as well. So what should concern me when it comes to corona? Should I be concerned about the coronavirus? And I think it's a very important time to pause as a community and say, is it about me or is it about others? And I think this is a time where we have to actually start thinking about others. So should corona concern me? Yes, you probably will be fine, but the people that may not be fine, we need to focus on. So, and I wanted to talk a little bit about that. The vast majority of infections will occur around us and amongst us, and many of us might actually catch this virus. When you look at some of the data, the vast majority of people, maybe 40 to 50%, don't even have symptoms. So that's okay. That means you're not going to get sick. Another 80%, another 20 to 30% on top of that might start feeling symptoms, and those are the symptoms I talked about. But there's only a small percentage of those that actually may get sick enough that they might need to seek medical treatment and might need to be hospitalized. And who are those people that are vulnerable? And these are the people that we should all come together to try to protect. And these people typically are the ones that we describe the high-risk group. And who are these high-risk individuals? You might have heard that it's typically the elderly and others, but I want to make it a little more specific for you so you know who to protect and who are the people that we need to be careful around. So when we look at some of the studies and the experiences that have happened coming out of China and Italy, we find that people that are at greatest risk of getting ill with corona, meaning that they might need to be hospitalized and potentially might become critically ill, are those who are elderly. So those that are typically 60 and above are the ones that are at risk. But it's not just that. Typically, they have to have disease. So we talk about diseases, that there are a couple of them that we can count on our hands that really put put people who might get corona at risk of actually getting seriously ill. And those are things like diabetes. Those are things like heart failure and coronary artery disease or any kind of heart disease, people who have bad lungs, so people with COPD or emphysema, also those people that have cancer or are under active chemotherapy. That's the majority of those sick, vulnerable people that we have to look out for and talk about in the next couple of questions. Who are also some people that might be at risk? So we want to think about others that have chronic diseases or a combination of chronic diseases that might make them further at risk for getting sick. Chronic kidney disease, people who have immunocompromised states, people who are active smokers. There are people who actually have immunocompetent states such as HIV and hepatitis. Those are the people additionally at risk, and also people who have strokes in the past as well. So how do I help these people? So the first question, again, going back to how do we make sure that we protect the most vulnerable people in our society? We just identified them. What do we do for them? Before we start thinking about ourselves, let's think about them. So as a precautionary measure, you've seen the governor cancel large gatherings. So it's very important that during this time that you protect your mother and your father, you protect yourself, you protect your grandparents, and make sure to avoid large gatherings or gatherings in general for them. So these types of people, although we don't want to isolate them and tell them to stay at home all the time, we want to make sure that they're practicing some prudence when they actually go out into the community, right? And if they are extremely ill to begin with, even before the corona, these are the types of people that should not go out. And that if we do visit them, we need to be extra careful around them in case we might give something to them. So what happens to people like myself who potentially may get sick and want to visit those vulnerable people? As a general rule, if you are sick, you're young and you're healthy, you shouldn't be visiting or seeing those vulnerable people. So if you feel sick or feel ill, have a cold, have nausea and vomiting, any type of illness that you might be thinking it's corona or otherwise, such as like influenza, you should avoid direct and close contact with these vulnerable people. So that means before you see them, obviously, of course, if you're sick, you're not going to see them. But let's say you are not sick, but around these certain people, you're going to want to avoid certain gestures such as handshaking and hugging. So we want to avoid that. Obviously, very frequent hand washing around them. And if you're caring for these vulnerable people, you want to get approved cleaning products and clean very frequently the areas in your house that are common places, such as bathrooms, kitchens, countertops, tables, and dressers, etc. So you want to make sure that their environment remains clean, and that you also kind of keep them away from people that are sick. So that potentially might mean keeping your child home or not taking them to those vulnerable people if they have snot and boogers coming out, if they're sick themselves. It's also important that if we do practice things such as social distancing, which is a term that we'll discuss a little bit, that if you do see these elderly people that are at risk, you make sure that you stay at least 6 to 10 feet away from them when you do visit them. And also keeping in mind, you need to have a plan in place for these types of people, that in the event that you get sick or others get sick that are caring for them, that there's a handoff to those types of people. So we need to also keep in mind that we don't want to isolate the elderly. We do not want to isolate these individuals that we love. And so a lot of social interaction still is important for them, seeing them, talking to them, keeping their spirits up, visiting them, talking to them on the phone frequently. All of those are appropriate measures. So when should someone isolate themselves? And we're going to talk a little bit about that. If you feel like you've come down with a fever and cough and chills, you should stay home and away from others. You should avoid social gatherings. You should avoid going out and eating and going to the restaurant, just to make sure that during this time that we prevent the spread of the illness and we break that cycle. When do I have to quarantine myself? Many people say, well, I'm just going to stay at home and I'm not going to see anyone. So we need to be, again, be rational and approach this in a very appropriate manner, and also based on science. At this point, no one is being asked to quarantine. The only people that have to quarantine, which means no travel, staying at home 100% of the time, unless you need to go see a physician, is if you test positive for the coronavirus or you're under investigation for potentially testing positive for the coronavirus. And those people ought to self-quarantine, meaning that they stay home and they minimize the contact with other people. And if they are sick, wearing a mask around others and staying in separate rooms from other people that potentially can contract it or get sick. The other thing to keep in mind is during a time like this, we talked a little bit about isolating ourselves. The CDC is recommending a little bit of a social distancing. What does that mean? And this is something that everyone should be practicing at this point. Social distancing is basically going out to the community for essentials. So, I'm going to the supermarket. I might be going to get some food. I might be going to see someone that's appropriate. I need to go to business. There is commerce. I want to support businesses. I need to go to the doctor. The social distancing also includes things such as, in our culture, we love to hug, we love to kiss, we love to shake hands. At this point in this next couple of weeks, we should avoid that. And we should, if we are together in groups and in gatherings, going out, in small little events, in meetings at the workplace, we keep at least 6 to 10 feet away from other people. The other thing that we should be doing is that if we get sick, we should probably immediately leave any places which other people can potentially contract an illness from us, including vulnerable people and the sick, high-risk people that we talked about. Social distancing also means that if you are around others, you want to practice safe practices in terms of preventing any spread of the illness. So if you're coughing, you make sure that you have a mask on. If you do cough, you make sure you cover it with your hands or your elbow. And if you do cough and you do sneeze, you go wash your hands immediately. And those are very important. Some other things that we should consider is that we shouldn't be holding gatherings, and I think there is a government mandate now that does not allow anything over 200. We should probably be safer than that and say potentially, any group over several dozen, we should limit. How do I break the cycle in my very own home and in other places? We talked a little bit about washing common places and cleaning them with approved cleaning types of sprays. We also should wash our hands very frequently. When should we wash our hands? Obviously, this is a common sense thing, but sometimes we don't think about it, so we have to practice it. If before, during, and after you prepare food, you should be washing your hands. When you use the restroom, you should be washing your hands after. When you are around others and caring for them, so if you have a sick and elderly person, before you start to care for them and turn them, you should be washing your hands. After you're done caring for other people and your children and cleaning them, you should be washing your hands. The other things you should be doing is if you do fall sick and you do need to go somewhere, you should be placing a mask on your face. Typically, the institutions that will receive you, such as a hospital, will have those masks ready for you. Some of the other things that we should be talking about in the event of an outbreak, what should we do as a community? I think in the general, we do know that we are potentially in the midst of an outbreak. As you know, there are 3 confirmed cases, actually 5 confirmed cases now locally in hospitals in our community in Dearborn and Detroit. So Corona is here. We talked about measures of isolation and quarantine. We talked about measures of preventing transmission to the sick, elderly, and vulnerable. The question now becomes, what happens if I get sick? We talked a little bit about isolating yourself, staying at home, making sure there are rooms for people in your house that are sick, and areas in rooms in your house that are for people that are sick and non-sick people. And obviously, if you are COVID positive or Corona positive, you should completely stay away from others and quarantine yourself for a minimum of 2 weeks. When should I seek medical advice? Now, I think many of us potentially, have this question in our mind, well, I want to get screened. Right now, it seems like the local institutions should, in the next week or so, start to have some testing available through drive-through. But at this point, the recommendation is that if you don't have a fever plus respiratory illness and recent travel to an endemic area such as China or Iran or Italy and other places, the local institutions will not test you. And the current health department and the CDC are not recommending that you get tested. You also potentially may be able to get tested if someone around you tested positive for coronavirus or is under investigation, meaning that they have a pending test for coronavirus. When should I actually go to the doctor's office and actually get checked out? Let's say I have a runny nose. Let's say I feel feverish. Now, many of us that are healthy don't have comorbidities, meaning that we don't have chronic illnesses. we likely do not need to go see a doctor if we do get sick. We can just practice those safe isolation measures to make sure that we don't spread the virus. But in the event that you and I do get sick, what are the symptoms do we look for? So the number one thing that happens to people that potentially can make them more ill in coronavirus is about 5 to 7 days after they get the initial symptoms of fever and body aches and fatigue and loss of appetite, they start developing shortness of breath. And at 5 to 7 days, the shortness of breath is from the development of a pneumonia, and it's a viral pneumonia. And so when you start experiencing those shortness of breath symptoms, that's the time where you should pick up the phone. And if you want to call the health department and ask them for advice, you can, the Michigan Health Department. You can also pick up the phone and talk to your primary care physician. If their phone is busy, you can come on into the emergency department, and of course, we'll take care of you. And obviously, we're always open for anyone that wants to seek treatment. So shortness of breath is one of those symptoms that means you are getting sick. Prolonged, persistent, severe illness, you're just not feeling better after 5 to 6 to 7 days, you should come into the doctor and get seen. Any signs of dehydration, recurrent vomiting, recurrent diarrhea, you should come in and get seen. If you feel that you're bluish in the lips or at your fingertips, you should come in and get seen. So those are the very basic things that can help you decide whether or not you need to come in and get seen by a physician in the emergency department or your primary care physician. If you can, try to call in ahead of time. So a lot of people want to ask, well, what if my father who is 65 years old, what if he gets sick with a fever and a cough? Those are the types of people, elderly, the high risk, the vulnerable, that should come seek medical attention right away. And there should be no deliberation of whether or not they should come in, because there are definitely a lot of complications that could potentially ensue in people that have chronic illness that can be managed in an inpatient setting. And this is when we want them to come to the hospital so we can take care of them. So we talked a little bit about what are the things that I could do if I do get sick to make myself feel better. So if you don't have any worrisome signs and symptoms that make you come into the ER or see your doctor's office, you can do several measures to make yourself feel better. Adequate hydration is very important, and taking anti-inflammatories such as Motrin or Tylenol for fever and body aches also help. Is there a cure for coronavirus? Just like the common cold and just like influenza and all other viruses in general, there are no cures for corona. Once you get it, you'll have some immunity toward it, and it shouldn't be an issue for you later on. Now, are there medications for coronavirus? Not at this point. There is medications currently under investigation, and there is some compassionate use of some medications in hospitals around the country, but at this point, there is no medication for the virus. Some people have questions about kids as well. What do we do? Are our kids at risk? Interestingly, when we look at some of the data that's coming out of China and out of Italy, kids are very infrequently and rarely affected by this virus. Almost all of it's self-limited, meaning that it's very minimal symptoms and they do fine. So we are thankful for that. The last question that I want to broach and talk about is preparedness and having kind of those checklists and essential items that you should be aware of between you and your family. So a lot of families do have people with chronic illnesses, so you guys need to be prepared. What if someone in the family gets sick? Making sure that you have a treatment plan for those elderly people that stay home. How do we hand off care? Who do we talk to? Who is responsible? Making sure that if your elderly is at home on their own, they have access to emergency contacts, such as a phone, a cell phone, some kind of device that can activate an emergency response for them in the event that you are not around them. So make sure that you are prepared. Make sure that you contact your primary care provider and they're aware that these elderly people are sick. And also techniques and how you will need to isolate your home in the case that you have sick and non-sick people at your house. And then lastly, I want to make sure that we all understand that during this time, if people do get sick and they are hospitalized, many of us love our family members, we love our shiddos, we love our moms and our dads, but at this time we should be, avoiding traveling to hospitals, because we as young people typically are the primary mode of transmission. And so going to these hospitals, going to these subacute rehabs, going to these nursing homes at this time might put other people at risk. We were talking again about those vulnerable people. So at this time, we want to limit that type of travel to those places. And if they do need to be hospitalized, talk with them frequently on the phone, discuss with the institution, the healthcare institution, if you are able to visit them. If you do visit them, make sure that you are wearing those masks and keeping a reasonable distance from you and them. I hope that I've answered the majority of your questions, friends. Hopefully the Islamic Center of America, hopefully the Islamic Center of America will continue community updates regarding Corona. It sounds like there is an infectious disease specialist that will be speaking as well very soon. And as always, if you have any questions, you can hit me up on social media. I'm on Facebook. You can search me. It might take me a while to respond, though. I thank you so much. I thank the Islamic Center for their graciousness. And assalamu alaikum wa rahmatullahi wa barakatuh.